When it comes to breast augmentation, bigger isn't always better. That's the motto Dr. Robert Shenker follows at the Cosmetic Surgery Clinic, and is a sound piece of advice he tries to pass on to all his patients. Dr. Shenker joins us to explain what women can expect when they visit him for breast augmentation surgery. This is Daily Web TV. Today we're talking about breast augmentation with Dr. Shenker. Dr. Shenker, breast augmentation, a very popular topic. Why do women choose to get this done?
There's a long list of reasons why people choose to get this done. Some women just never developed in a way that they wanted to. Some women have breast asymmetry. Some women have a particular aesthetic goal in mind that they can't achieve any other way other than surgery.
What about post-pregnancy? Do a lot of women come in here to try to get that fuller breast?
Yeah, there's two times in a woman's life when they're most likely to seek breast augmentation. One is in their early 20s when they just realize they never developed as big as they wished, and the other is postpartum. So they've had great breasts in the past and they've lost some of the volume or some of the shape or had some skin laxity after pregnancy and breastfeeding.
The question that comes to mind for me is, how big do you determine, or how do you determine the size of a woman's breast? I mean, are they coming in here and saying they want a particular size, and do you have enough skin to cover that?
Interestingly, patients who come in nowadays come armed with more information than ever before. They tell you what size they want and what kind of implant and how many cc's and where you should put it. The problem is that the determination of size is based on a lot of anatomical factors, such as the width of the breast or the height of the breast or the amount of skin and breast tissue that's covering the chest wall. And those things are what they are, and you can't alter those. So you have to work within the confines of the anatomy, and you have to take the patient's goals and desires and make them mesh with their own pre-existing anatomy.
So you're going to sit down with us and actually do a consultation to say, this is what's going to suit your body? Or realistically,
it's
going
a
to work?
two-pronged approach. I will do that in the consultation with a bunch of measurements and a bunch of physical examination techniques, and then they'll meet with the rest of my staff or one other of my nurses to do some specific sizing.
What are the different types of implants that you use?
I use them all. There are saline implants, there are silicone implants, there are shaped and round, there are textured and smooth, high profile, low profile. There's many, many different types of implants, just as there are many different types of breasts. And so there's no cookie cutter recipe. You know, you have to examine each patient based on their anatomy and based on their goals and pick the implant that's best for them. So
there's not a particular implant that you use over the other because it depends on the patient?
No, there are some that I use more often because those specific types of anatomy are more common than others. But I think you have to be careful if you go over to see a surgeon and he says, I only use one kind of implant. It's wrong to try to shoehorn every patient into a particular kind of operation. You need to tailor the operation to the patient's desires and the patient's anatomy, and that's what we do.
What's the recovery time like? Is this a Thursday surgery booked and I can be back to work on a Monday?
The answer is a definite maybe. It depends on the patient and depends on the implant. Okay. If you're putting in a modest-sized implant in a patient with a decent amount of skin laxity and their job is not a high-demand job, a high physical demand job, you could certainly be back at work in 3 to 5 days. That's not uncommon at all. If you're putting in a larger implant in a very tight breast, it might take a little bit longer to get back to work. And if your job is very physical, you might need 5 to 10 days or so.
What about the scarring on the breast? Are we going to have, are they going to be all cut up?
No. Every single patient I see is concerned about the scar initially. It's their biggest worry. Where's the scar? How's the scar going to be? And I can honestly tell you, after all the implants I've done, I've never ever had a patient come back worried about the scar. It becomes a non-issue because they heal well. And it doesn't matter if the scar is in the inframammary fold or around the areola or in the armpit. It doesn't matter. They all heal well.
Common myth about breast augmentation? Is there a common myth out there that people come in saying all the time to you?
Yeah, people ask me all the time if they can go on roller coasters afterwards because they think the implants are going to rupture or break, and I think that's bunk.
So we can still go on roller coasters after an implant?
You can still go on roller coasters.
Okay, well that's good to know. Well, thank you very much for all your insights, Dr. Shenker.
No problem.
For more information on the Cosmetic Surgery Clinic here in Waterloo, visit their website at drshenker.com. Connecting you to your local community, I'm Tracy Pizot, and this is Daily Web TV.